HIV transmission from mother to child during pregnancy, labor and delivery or breastfeeding is the most common route of HIV infection in children.
Elimination of mother-to-child transmission is important in Uganda because it is the commonest mode of transmission of HIV to children in Uganda. If you have children aged less than 5 years, over 90% or even 98% of these children actually acquire this HIV infection from their infected mothers, either during pregnancy, during time of delivery, or during breastfeeding. So the ministry recognizes that if we can combat or if we can control this method of HIV spread to the children, then we can have children who are free of HIV in our country.
Fortunately, the use of certain HIV medications during pregnancy and labor can dramatically reduce the risk of passing HIV to the infant. However, not all women are aware that they are infected with HIV. In 2010, the ViiV Healthcare project, which specifically targets HIV-positive mothers, was introduced in Kiboga and Kyankwanzi Districts in Uganda. The aim of the project was to reduce transmission of HIV through supported prevention of mother-to-child HIV transmission.
ViiV is a project that was set up to explore how you can engage and mobilize the community through community-based organizations, principally to sensitize women of reproductive age to get an HIV test, to prevent unwanted pregnancies, to attend antenatal clinics when they get pregnant, and for those who are HIV positive, to ensure that they deliver in a facility where they will have access to these technologies.
A major bottleneck to prevention of mother-to-child HIV transmission is the high number of mothers who miss their appointments at health facilities between the first antenatal care visit and the point at which the child is finally tested for HIV.
Mothers are still having stigma. If a mother comes alone and you capture her when she's negative or is positive, you sit with her, you talk with her, thinking that she will tell you that let me go back and disclose either to mother or husband. She said that for me I will talk when I want to talk to him. And as you a midwife, you can't enter in to do what to tell the husband, because it's the mother's responsibility to do what? To talk to her husband. That stigma, they are still having it.
The Infectious Diseases Institute, using an innovative approach, identified 15 rural community-based organizations in 2 of the districts, built their capacity to manage small subgrants so as to effectively raise community demand for prevention of mother-to-child HIV transmission services, and gave them technical assistance in order for them to be able to provide support to health facilities in reaching HIV-positive mothers and exposed infants, hence creating a strong, comprehensive district-based health system.
CBOs, or community-based organizations, are very important structures in the communities. They're able to mobilize communities quickly because first they understand the communities better, the cultures around. It will be difficult, for example, for a health worker to go and look up for a mother that's lost to care. So when you use a community structure like a peer mother or a CBO member, they're easily accepted by the community. And besides, they're more sustainable.
Although the healthcare workers can identify the mothers who have missed appointments, they do not have the means to effectively follow up these mothers. The project, through the community-based organizations, supported the health facilities in this role by designating village health teams or peer mothers to follow up these mothers through phone calls and home visits.
A peer mother is a lady living positively with HIV. She has gone through the PMTCT services with her infant, and her main role is to provide peer counseling to the newly identified mothers with HIV, to provide, share her experiences and encourage the other identified positive women to go through the services and adhere to the treatment services that are needed, are required, and her appointments at the facility. She also serves to link and provide services at the level of the lay population, linking the women to the health workers.
I was healthy until when my husband started falling sick. His health deteriorated and was admitted in hospital. When I inquired what it was, he told me he was HIV positive. Because of his health condition, I decided to go to hospital for blood testing, and it was discovered that I was also HIV positive. I was then started on treatment.
Many HIV positive mothers and their exposed babies are being lost to follow up during the prevention of mother-to-child HIV transmission. Early infant diagnosis due to the existing culture of delivery from home or traditional birth attendants. Limited awareness by the family of the importance of reproductive health and early infant diagnosis services available at the health facilities. With funds from the project, a mother's waiting shed was constructed in a very remote part of Kiboga district to accommodate at-risk mothers coming to access antenatal services. This health facility has over 70 mothers coming in for antenatal care services monthly. Apart from antenatal services, it also offers outpatient medical services, HIV care services, laboratory services, and immunization.
By putting up a mother's waiting shed, you create an opportunity for the mother to come and spend a week or two. And when she needs to, or when she goes in labor or needs to get a C-section, she's right next door to the hospital. Two is, whilst she's in the mother's waiting shed, she's captive audience for education, for encouraging her to take an HIV test.
The project has also improved pregnancy outcomes by ensuring that mothers, especially those who are HIV positive, receive proper antenatal care, deliver under supervision by a health professional, and get the necessary prevention of mother-to-child HIV transmission services.
I gave birth to my baby in the hospital. After 1 month and a half, the baby was tested and she was HIV negative. That was very good news for us.
The challenges to reach pregnant women in need of prevention of mother-to-child HIV transmission services are immense in the region. Although great efforts to establish prevention of mother-to-child HIV transmission services have been made, many pregnant women in rural areas do not have the means to reach them. For many of the mothers in the project areas, the distances to health facilities were often long and transportation a challenge to them, which prohibited them from seeking healthcare services. To mitigate this challenge, the project provided transport vouchers to mothers to facilitate them to access the health facilities for antenatal care, postnatal care, and early infant diagnosis services.
The transport voucher system is about pregnant women and lactating women being identified at the facility, and they are provided a voucher, which is a usual, just a paper that has details about the mother, and the mother is able to provide this to a border cyclist because they are the easiest and most available transport providers within the villages that they bring, that they are able to carry them to the facility, and while the health workers acknowledge receipt of the mother, and then their border cyclist or the transporter is then able to come back to the community-based organization to be able to pay out that transport.
This arrangement has been very helpful. I am a farmer and my sales are seasonal, yet I have to go to hospital every month. In addition, the distance from home to the hospital is too long. But now, in case of an emergency, transport is always availed, and I am able to make it to hospital in time.
The unique thing about this project is life-saving. It is very unique. It has saved number of babies, infants who would be born positive, HIV positive, but it has saved them. They have been born HIV negative. Life-saving, and we are proud of that. And the community is very appreciative.
To curb the challenges, the project is ensuring that correct messages relating to HIV and AIDS are developed and supplied to the community in order to become more educated about the facts and educate those around them. Different media such as radio, film shows and drama are used to relay the messages.
Because of these activities, drama, film shows, they even attract the conservative elders who come down to watch. But at the end of the film, at the end of drama, they learn something. They learn that testing is important, because where a woman, after knowing that she's HIV positive, she goes for PMTCT services, and now she saves the infant, and herself lives longer.
While the project has made progress in achieving its purpose, it has also had challenges.
10 CBOs and 1 mother's waiting shed is not going to meet the demand and the need out there. And often when you're publicizing these services through radio, you generate demand which it's hard to supply. From the supply end, you may not have enough places or people to provide the services that are required. So that's a big challenge. 2 is clearly that there continue to be myths in the community. If you deliver in hospital, you're more likely to die. You deliver at home. The myths that traditional birth attendants are better.
You find out that some women even are refused to come for meetings. You find out that some women are refused to go for PMTCT services. When she comes, maybe the husband is absent at home, and when the man is there, she misses the appointment. So when we follow up, you find out that this lady tells you that, the other time I came because my husband wasn't there. This time he was there, so I had to miss. So you find out that one affects our work so much.
The biggest challenge we still have in the community out there is stigma and discrimination. Many couples or individuals are fearing to come out to test for HIV because they fear that once they test for HIV and they are found HIV positive, the communities where they live will discriminate or stigmatize them. So to decrease this, we are working with community structures. Again, this is one of the roles of the community structures, to try to minimize stigma and discrimination in the communities.
The mother-to-child transmission, which we found at the beginning, we did a baseline. It was over 10%, but as we speak, this has come down to slightly below 5% as a result of this project. So this is a great achievement which the project has had. And then the other one is that the other big advantage or achievement that we've had is that we've worked closely with other stakeholders for proper coordination to avoid duplication of services and wastage of resources, where the project has managed to have coordination meetings with different stakeholders on PMTCT. And as a result, we have even formed a coalition of community-based organizations that address PMTCT issues.
There are tremendous changes in that now mothers attending antenatal are attending in large numbers, especially the 2nd, 3rd, and 4th attendants. Originally, we used to have mothers attending the first attendance was about 90%, and the subsequent ones, because they were coming late, subsequent ones you'd attend only once or maybe twice, and that is it. But you realize now they are attending more than once, and the numbers have gone up those who have attended more than once.
Ministry of Health is a signatory to the global plan for elimination of mother-to-child transmission by 2015. And we have adopted the global targets for elimination. And the targets for elimination that we have adopted as a country is that by 2015, we want 90% of women living with HIV in our country who are pregnant and breastfeeding to be receiving antiretroviral treatment. And we think this can help us to reduce the risk of mother-to-child transmission of HIV to less than 5%. And our target also is to make sure that we reduce the number of children who are getting infected with HIV from their infected mother by 90%.
To ensure that the gains made in reducing mother-to-child HIV transmission in Kiboga and Kyankwanzi are not lost beyond the project's life, the project management team has drawn up a phase-out plan to facilitate continuity of services even after the phase-out of ViiV Healthcare supported project activities.
Sustainability for this project is ensured through the capacity that has already been built by the community-based organizations that we found already in existence to be able to provide this technical support that is required. In addition, the community-based organizations are also being empowered to be able to seek funding from other sources, as these community-based organizations not only do PMTCT services, but they also do other services like orphans and vulnerable children and saving schemes and loans. So we have built their capacity to be able to continue seeking funding from other sources to support the community structures.
Obulwadde bwa mukenenya mutumala otwekume.